Good morning. I have myself, Annie Cathy, Andrew Chorney, David Strohmeyer, Kyla Leonards, Lisa Bekovich, Violet Plummer, MCAT. And it looks like in 206 we have Commissioner Vero and Brian West.
That's it.
That's it.
Well, is there any public comment on items not on the agenda? Okay. Oh, we do have a little consent agenda. 3 items. Anything that needs to be pulled out separately?
Holy smokes, that is the agenda. I would move that we approve the consent agenda.
Second. Any further discussion? Okay. All in favor? Aye.
Aye.
No action items. We have discussion on wildfire update. I don't see Adrian on. How about any public comment for 23 budget? Why is Brian West here? Are we in trouble?
I said it was a nice day, so I just walked
Okay,
along
okay.
first.
I think we're looking at a record time
It
for this
really
meeting.
is. Okay.
I see it.
Oh, Lisa's. Go ahead, Lisa.
I just want to say something. I've never been to a meeting that's so speedy. I didn't even know what to say, when to say. I know I'm not here for a formal presentation. I just want to update you on one edit to the contract that you just approved, just for your
Thank you.
knowledge, but that's okay.
Yes, please.
So the HUB contract that you just approved, it's a standard contract that for our prevention programs at the health department and Partnership Health Center. But we had to remove one program, which is our Missoula asthma program that we've had for multiple years. We spent over a year, probably closer to a year and a half, trying to hire a public health nurse to do the Missoula asthma program at like 12 hours a week. And we're very unsuccessful. We had 0 candidates. And so we removed that from the contract from the state. So just wanted you to know for your knowledge and working in our community, that program no longer exists because we couldn't hire anybody for that position. So just FYI.
Okay. Thanks
Okay.
for the clarification.
Yep. Okay. Well, have a great day.
Thanks. Had I known that, I would not have agreed to sign it. But I guess it is what it is. So
It is what it is. We'll have to continue to try different ways to, it needs to be a more full-time position. I think these small part-time positions are really hard to fill in the county. So, or probably with any business and organization. So we'll just have to think about other ways to serve that population. So,
Just
okay.
because the opportunity presents itself, I'd say when we need to ask if anybody wants to discuss one of the consent agenda items, that's a good time to raise your hand and say, pull it off. And then you can update any changes that you need to do.
I probably rushed through that too quickly, so thank you.
I want to get done by 10:03.
Right, I know. And it looks like Annie, you have your hand up.
I do, commissioners. We just had Terry Kendrick join us, and she had an item that wasn't on the agenda that she wanted to discuss.
Oh, so sorry, Terry. Go ahead. There we go.
Good morning. So I talked to Commissioner Slotnick yesterday. The Strategic Alliance is putting in public comment to Montana DPHHS about an administrative rule changes regarding the Medicaid reimbursement rates for crisis receiving centers. And the way they have it now is the rate per hour is $21.16 per hour. And if someone stayed the 23 hours and 59 minutes, which is the crisis receiving center length of stay, that daily rate would be $507 and something, which is great. You know, that's a better daily rate than they had. The issue is that most people don't stay 23 hours. They stay an average of like 13 hours. And the majority of the work is done in the first few hours that they're there. So the assessment, evaluation, you know, coming up with a treatment or, you know, goal plan, you know, then and let's say then they're resting, you know, you kind of need to monitor someone who might be under the influence of a substance those first hours while they're sleeping to make sure that, you know, that they're okay. And so I worked it out that we could not break even if that rate stayed a flat 21.16 and people averaged, you know, staying 13 hours, that we would lose money. And then, so I'm putting in comment to say, could they front load the amount so that the first 4 hours are paid at a higher rate? And then the last hours are paid at a less amount. It still adds up to 507 and some change. So it doesn't change the daily rate, but it allows for payment for the sort of medical and behavioral health licensed staff that are doing that initial amount of care.
What's the suggested rate for the first 4 hours?
So the first 4 hours I put at $50 an hour.
Got it. Okay.
So it'd be like $200 for those first 4 hours. And then it drops down to like more like $15 an hour for the remaining at 9 hours, you know,
Okay.
and we would still potentially lose some money if we had 13 people, but it'd be like 100,000 a year, you know, but if we went up to 16 people a day, we'd be okay.
Terry, has it ever been contemplated to change the rule such that if you hit a certain threshold, you just get reimbursed for the entire day rather than?
Yeah, right. I mean, I think have spoken to them about that. And, you know, I used my example. I don't really, in some ways, care if they do exactly, you know, the model that I suggest, but some way of front loading it so that people can meet their expenses, because the deal is you have to have the level of staffing, you know, you can't just, well, you know, it's like, oh, okay, we only have 3 people here or something, so we won't have an RN or we won't have a licensed clinical social worker. I mean, you can't do that. And so you have to pay those folks 365 days a year. And so we just need to make sure, I mean, I do feel that in relatively short order, you know, Missoula will be likely at capacity, but that relatively short order could be a year or, you know, 6 months. And you just don't want to go, I mean, the way they have it now, like, you know, if someone stayed 13 hours and I don't have my document right in front of me, but, you know, could lose a substantial amount of money. So
I guess the example I use, and this is a little bit of apples and oranges, but think about how we reimburse folks for travel. And there used to be a time when I first started with Missoula County that we required employees to submit receipts for meals to get reimbursed.
Mhm.
And we moved away from that to adopt what the federal government does, which is that regardless of how much you ended up paying out of pocket, you're going to be reimbursed if you're in travel status for X amount for the entire day or 3/4 of the day if it's your first and last day. And in so doing, realize that the accounting that goes
Yes.
into having to track all the little individual receipts was
Right.
far more than what you thought you would be recouping by way of
Yeah.
doing it that way. So
I mean, that makes a ton of sense to do it that way. And the other thing that really is worth noting is, so, you know, you have to meet your expenses. So then this incentivizes people to try to get people to stay longer then they need to. So somebody's really kind of ready to go home, you know, or something, and then you're like, oh no, please fill out let's do this exercise, let's do, you know, and that also that someone could go home and then that space opens up for another person who may be in crisis, you know. So so what I'm asking for is, you know, that the Strategic Alliance members are reviewing the document and signing on to say they support, or, you know, that changing the administrative rule. And so what I'm asking is it okay to list the Board of County Commissioners as being in support of changing the rule?
Yes.
Yeah, fine with me.
Okay, great. Thank you. Thank you so much. But I'm going to add your comments, your idea, Dave, into my public comment letter.
Yeah, it's just a way to, I get it that folks are thinking that, well, if you do it on an hour by hour basis, you're going to be saving money. But in reality, because of the sort of disincentive or incentive to stretch things out that you're talking about, plus just the added administrative costs of tracking all of that, you might not be saving as much or any money ultimately.
Right. So, okay, thank you so much.
Yeah. Thank you, Terry.
Have a great rest of your day.
Thank
Bye.
you.
Anything else? Still at 11 minutes.
That's pretty good.
Wait, I have an important.
Oh, geez, who keeps screwing this up here?
It's worth it. So I just wanted to say really quickly that with 174 votes, Gidge the three-legged dog is going to be our first ever Missoula County Commissioner.
I was wondering. I really was wondering. Okay, so that's it.
Okay.
It's been decided. It's Ditch.
Gidge.
Oh, Gidge. How do you spell it?
Yes. Gidge.
Okay.
Gidge the tripod. TRIPAWD. Tripod.
Yeah. Okay.
So we'll have an official proclamation here at a
Okay.
meeting for you guys in the next.
Okay, so we have a fourth commissioner.
We do. Who unless Brian tells me otherwise, I'm going to assume has the same legal authority as the human commissioners.
Okay,
Okay.
of course.
Great. Thanks, Allison.
You bet.
Thank you.
Okay. Have a great day, everyone.
Goodbye.
Bye.